Moving on, the United Kingdom government is grappling to control the third wave of infections, and in an important announcement, British Foreign Secretary Dominic Raab has said that the vaccines will be offered to the entire adult population by the end of September this year. Let's listen in.
To get the first 15 million most vulnerable people vaccinated with the first dose by the middle of February. We then want to get by early spring another 17 million. At that point, we'll have 99% of those most at risk of dying of coronavirus administered their first jab. And then the adult population, entire adult population, we want to have been offered a first jab by September.
Over 705 and clinically extremely vulnerable who now number more than 5.5 million nationwide will be invited to receive the vaccine from today. This will take place in areas where most of the first priority groups of care home residents and over 80s have now had the jab. Nearly 2 weeks after starting its inoculation drive, more than 4 million people have received the first dose of a COVID-19 vaccine in Britain. And the UK Health Minister Matt Hancock said that the authorities will be going 24/7 with the vaccinations to speed up the process. This as the coronavirus crisis is worsening and the NHS is at its most precarious situation.
Our approach, of course, is to save as many lives as possible, as quickly as possible, and to reduce the pressure on the NHS. We're on track to deliver our plan to vaccinate the most vulnerable groups by the middle of February, the groups that account for 88% of COVID deaths. And I'm very glad to report that as of midnight last night, we have now vaccinated 4,062,501 people across the United Kingdom. And we're currently vaccinating more than double the rate per person per day than any other country in Europe.
There are more people in the hospital than at any other time during the pandemic. Someone gets admitted into a UK hospital every 30 seconds, and there are currently more than 37,000 COVID-19 patients in hospitals across the UK. As the new, more contagious variant of the coronavirus continues to tear through Britain, with an estimated 1 in 30 people in London currently infected, hospitals are on the verge of being overwhelmed, even as authorities struggle to convince the public of the urgency of the moment. And the National Health Service fears that even if the rate of new infections slows significantly, hospitals in London could face a shortage of beds too. In order to curb the further spread of the virus and contain the rising number of infections, British Prime Minister Boris Johnson had declared shutting down of all travel corridors, and the UK is currently under an indefinite national lockdown with all non-essential travel banned.
Foreign Secretary Dominic Raab says the government will soon begin a trial of round-the-clock injections, and as it continues to add more vaccination sites to increase the pace of delivery. He says the target is by September to have offered all the adult population its first dose. Now, Britain has more than 51 million adults. This vaccination program comes on crushing pressure on the National Health Service. Hospitals are admitting a COVID patient every 30 seconds, putting the service at its most precarious situation ever. Since Christmas, there has been enough new COVID patients to fill 30 hospitals. And the surge of infections have seen over 37,000 people admitted to hospital. That's 73% higher during the first peak of the pandemic in April. The government says it won't review the lockdown measures until mid-February, by which time it plans to offer at least one dose of vaccine to everyone over 70, as well as frontline healthcare workers and those who are especially vulnerable to COVID. Now, Britain has chosen to stretch out the time between the vaccination doses from 21 days up into 12 weeks. And that decision means more people will get at least one dose more quickly, but some are questioning, will it affect the efficacy of vaccine? Mandy Clark, World is One, WION, London.
WION is now available in your country. Download the app now. Get all the news on the move.